can hear destiny calling, calling out my name. Need no shield. Now watch me feel. Failure is not
Just 2 minutes. 2 minutes to help your body move. There you go. There you go.
I choose to thrive. I will learn with force, never on my knees. I am not the same. I'm different. I am not the same. Yeah, I am not the same.
Everything hurts so bad. Like excruciating pain. The brain is physically in so much pain. The nerves from my back of my head, through my neck, through my back.
All right. Welcome to the Face of Malpractice. I am your host, Melissa. For those of you tuning in for the first time, this channel is dedicated to featuring interviews with fellow psych drug harmed warriors. It is not just my story to tell. This platform is meant to create space for others to share their truths. On TikTok and my new Instagram page, I will continue posting a mix of content, including videos about my journey through psych drug injury and educational material. Be sure to follow me here on YouTube as well as on TikTok and Instagram for a variety of updates and insights. So today we will be interviewing Deborah. Deborah, I don't want to butcher your last name. How do you say your last name?
It's Schwartzkopf.
There we go. Schwartzkopf.
Yeah. Yeah.
She is a retired level 1 ER nurse. She is an activist on the issue of mental health, in particular to ECT and benzos, and she has settled a lawsuit around benzos prescribed in 2013. Thank you, Deborah, for being with us today.
Thanks for addressing these issues, very important issues.
That's right. They are very important issues. So thank you again for being with us.
My pleasure.
I think a good place to start is, why don't you tell us a little bit about your life before you were prescribed benzos, and like, why were you prescribed benzos and how long were you on them?
Yeah, I was in a very dysfunctional marriage, and I stayed in that marriage, sadly, for 35 years. And I couldn't quite figure out what was going on with the marriage. It was narcissistic abuse, and early on, we didn't know all that was involved with narcissistic abuse, and so the gaslighting was prevalent, and I couldn't tell which way was up half the time. And I became very unhappy in the marriage, and so, like a lot of women, we get identified as the problem. And so I sought out psychiatric help, and I saw this psychiatrist for at least 2 years, and she was a very good psychiatrist. And I wasn't on any medications or anything like that. And my marriage continued to deteriorate, but there was so much going on with my job and raising 2 kids and, all that going on. I thought, well, it's my issues from childhood that I'm having to address now. And so the psychiatrist said, well, there's Prozac that's new on the market, because this was a long time ago. And within several weeks of being put on Prozac, I became very preoccupied with guns. I became preoccupied with hostages. This is not my normal baseline at all. And I started to have manic symptoms. I moved a lady into my home that lived across the street and redid her whole bathroom and kitchen. And, so it was really bizarre behavior that was going on. And a lot of the thoughts of violence I didn't share. I just kept them to myself. And so what finally happened was I ended up with a SWAT team outside my hotel door one night, and my psychiatrist, realizing this was far from my baseline, immediately withdrew the Prozac. And all these thoughts like left my mind. It was like gone. And so given all that had transpired, we decided that, thinking to move might improve the situation in our marriage. And I didn't realize, that was a fallacy. And so I started seeing another psychiatrist, and fairly quickly she wanted me to start on an SSRI. And knowing full well what had transpired in Denver, I told her my concerns about doing this. She led me to believe it's a different formulation. These incidents don't happen that much, and blah, blah, blah. And I started it, and within a couple of weeks, I bought another gun. I attempted to take this psychiatrist shopping with me at gunpoint. Luckily, this didn't pan out. I was hospitalized. The only diagnosis I had prior to this was PTSD and some depression from my previous psychiatrist. Now, because given this behavior of mine, this drug was not stopped. A list of DSM codes was given to me. A list of drugs was given to me. And electroshock was prescribed for the first time. Before this incident happened, I did have a brief hospital stay under the care of the psychiatrist. And in the notes that I later read, it said that I displayed some manic behaviors and some slight psychosis. And so they knew, that I was deteriorating, yet nothing was changed. And so this psychiatrist was no longer going to see me, understandably. And so I came under the care of another psychiatrist, and this psychiatrist was the one that initiated the benzodiazepines with me. And I feel my situation was that could have been quite vindictive around my care, given my behavior with this other psychiatrist in retrospect when I look at things. And so this new psychiatrist started to escalate my medications. I was on Seroquel at 1200. I was on, of course, Depakote and lithium, or combination, or one or the other. I was prescribed toward the middle and toward the end Ativan at 25 milligrams a day. I was prescribed Ambien, which is normally 5 to 10 milligrams at bedtime. That was being prescribed at 10 milligrams 4 times a day. These were not the only benzos, nor the only hypnotics. And the pharmacists filling these, I was getting them filled mostly at Kaiser Permanente. Not one pharmacist said, this is, obscene dosages. I was so compromised that even with my nursing background, I couldn't figure out how to get out of this situation. I had a spouse that was encouraging me to be compliant with these medications. When I was not, the paradoxical response to benzos, that when you get to the higher elevations, I was not sleeping for days on end. And when I pulled my records, when I later sued the psychiatrist, the numerous times that was put in there about these were paradoxical response, they knew full well it was a paradoxical response. And they would bring me into Kaiser, and they would drop me down to 1 milligram every 6 hours of the Ativan from 25, and they would electroshock me. And so benzos are given to stop seizures. And so when I would come into Kaiser, my blood levels, of course, would be toxic. And so they would have to really crank that ECT machine up to get me to seize, to override those levels of benzos in my system. And so not one, and so because of the amnesic properties to benzos, as we all know too, I was always overdosing. For 7 years, I was in a hospital setting on average for one thing or another every 15 days. I had the police at my house. I had ambulances at my house consistently because I would overdose. I would forget what I had taken. Some of these, I'm sure, were suicide attempts because given all that was going on, not sleeping, highly impaired, I'm sure I did attempt suicide, but that is not my baseline again. And all these overdoses, I would forget what I had taken, and I would take all my heart medicine, all my thyroid medication, never mind all the countless psych drugs I was on. And so I would go to the ER, many ERs in Oregon and many psych hospitals in Oregon and even Washington. And not one ER nurse that I'm aware of, and it was not in the notes, did an intervention that was so needed, just giving additional labels as a problem for their ER. But when nurses and doctors see these patients come in that are highly impaired on benzos or have access to benzos, assess their home situation, assess what's going on with the prescribing, because a lot of times patients are so impaired that they can't even give an adequate history. And even 1 month alone toward the end, I had 6 ICU admits just for 1 month. And I was a type of ER nurse that if you came in and I saw this pattern after the first time, the second time, I would be following you outside the ER, knowing your home situation. And I wouldn't have let you go until I saw those prescriptions. But I was discharged often from Kaiser with the same amount of prescriptions, the same dosages when I was discharged. And so I couldn't understand that. So patients have to be very cognizant. And when you start having feelings that something is going awry with your psychiatric care, start pulling your records. In fact, I would pull them if you're getting weird feelings, what's going on, every 6 months, and have them write down on a prescription or whatever your actual diagnosis, because you can get some squirrely psychiatrists. I mean, some psychiatrists have their very own real issues that they take out on vulnerable patients. And this psychiatrist that I had was either a narcissist or a psychopath. That's my personal feelings. And the psychiatrist I tried afterwards, she was very helpful to me. And in fact, wrote letters on my behalf to help me secure representation from this other psychiatrist. Yet after 2 years, she went off the deep end, gave me a personal Valentine card that she made, falsified my records highly, totally did a 180 on her care of me and her interactions with me. And luckily, what I did when I started feeling these feelings that this psychiatrist had some real issues, I did some research on her. She had some board actions in the past. Check your psychiatrist, check for board actions. The psychiatrist that I sued, I called the Washington State Board. I said, I settled this lawsuit against this psychiatrist. He's highly dangerous to patients. They wouldn't mark his chart or his record with the board. And she was sympathetic. She said, Deborah, she said, I know what I sent her my records, of what this guy did to me for 7 years. And she said, Deborah, I sympathize with you, but they're so highly protected. And they could not make a notation in his record, that he overprescribed even. And so, when you find a dangerous psychiatrist, you have to call them out. And he is named in my videos under Grand Trined, because I will not be silenced. He is a danger to patients, or at least he was, unless he's cleaned up his act. And this other psychiatrist, that made me the Valentine and crossed boundaries with me. And she actually caused me more harm because I had trusted her so very much. After everything that I had been through with the benzos and having a self-detox off all those benzos, after a near-death experience, I thought she was in my corner. And when she started turning on me, and she actually sent very inappropriate emails to me using the F word and other derogatory comments about a visitor that I was having. She was jealous in these emails that she sent to me, highly inappropriate. Abandoned treatment with me through an email after 2 years, telling him to stay the F away from me. And it's documented in these emails, and with her name in these emails, as a psychiatrist. And I made copies of all those emails and copies of all my records prior to her going down, crossing over to the dark side with me. And I sent them to the medical board. And I said, she's a danger to her patients. And do you think the board did anything? No. I didn't hear squat from those people. And so she's still out there practicing. And I found out where she practiced. And I sent a copy of all her emails to her employer with a copy of my records too, highlighted, saying this is how she's falsified records on patients. And so you've got to hold these people accountable. They can't get away with this stuff.
First off, Deborah, what a devastating story. I have to be honest. I mean, I hear stories all the time. Obviously, I also speak out. This was really painful to listen to, because it should have stopped at the Prozac. And now it's coming to light how these drugs cause suicidal ideation, cause rage, cause violence. I mean, we look at the people that are shooting up schools, they're all on antidepressants. And like this is all starting to come out, though like it's coming out in the media, though doctors don't seem to be listening. I feel like it's like everyone else listening but them, funny enough. But it's to hear that they could once, and this is what continues to happen, once someone is injured by a drug, instead of understanding that there are multiple reasons why that could be happening, they just go, oh, let's go to another drug with similar properties. Even if it's not similar properties, they're working on similar neuroreceptors ultimately, right? And it's like,
Right.
not everyone has a positive response. Most people actually don't. Like, if only 30% of people on antidepressants actually find relief, what's happening to the rest of the 70%, right? So I am I am devastated to hear your story and then to see that they push you through ECT. And then I can't imagine the darkest of nights that you endured and having a system convince you it was you and gaslight manipulate you. And it sounds like you also had that surrounding in your home. So you really have not had, you didn't have safety anywhere around you. So I am so sorry to hear your story. You certainly are a fighter because you're going after the system. You're going after these doctors. You've made that movement, and you highlighted something that I think is really important that I actually don't talk often on this channel about, but it's about like getting the getting the medical records. These doctors are lying on medical records. And I actually I'm writing a book and I actually expose that through my book as well, is like what's happening in the session and what they're writing in their notes are two different things. And it's because they need to cover themselves. And so I think to Deborah's point is every time you're going to a doctor or every few sessions, ask for your records and read through them. And when you see there's something wrong, because I assure you there will be, because they will be lying about something, you need to call them and be like, this is not true. This is not what happened on this day. This is exactly what I said. My records need to be updated. Because otherwise, when you're in a situation where you're harmed by psych drugs and doctors and you want to proceed in a lawsuit, they tend to favor with the doctor because all of a sudden they have some type of license as if that means that they're telling the truth somehow. And so you make a lot of relevant points, and I'm so sorry for the journey you endured, Deborah. Truly.
Thank you.
And
Another important point
please.
is that when you go to get like I used to have the website ECT Justice. That's now owned by attorneys that did a class action on ECT devices. But on that site is an area, given my experience, about getting your medical records. So if you're seeing a psychiatrist privately, pull those records every few months. And if you've been in a hospital setting, pull those records. But on that website, ECT Justice, is how to go about getting your medical records. It is not easy. I had to actually pay an attorney $5,000 to get my records in time to sue because they were holding their records because they knew that I was going to sue them or try to. But when you go in so reference that website under medical records, how to pull your records. And when you go in, tell them it's for personal reasons, not legal reasons, because that'll just slow things down even more. And if they're giving you a hard time about getting them, you can report them to the Office of Civil Rights. And my case was formally investigated because they were holding on so tightly to those records. So there were emails going back and forth. Should we release them? What's she going to do with them? Yeah. So pull those records, and I would keep them up to date. Yeah.
Good for you, Deborah. I love that
Yeah.
you are a fighter and you didn't give up on that. So that
Right.
is awesome. And so let's continue on. So what I want to understand now is what did coming off the benzos. So when you were on the benzo, were you still on that other antidepressant?
Yeah, I was, well, sorry, so you have to bear with me. So I've had 66 ECT plus high dose benzos for 7 years. So my memory can be quite impaired. So I cannot, what finally happened, what saved me in all of this, because, oh, I forgot to tell you something. So because of the paradoxical response to benzos, and I wasn't sleeping you know, with all these benzos, I became very agitated and displayed like manic symptoms, and I was grossly confused. I don't remember doing this, but this is what I was told, that I would take pictures off the wall and hang them upside down, that I would drive and not, I mean, nobody took my keys. I mean, my now ex-husband let me drive with my children in the car, and I could have killed somebody easily. I know if he had even a therapeutic dose of benzos, he wouldn't be driving my kids in the car. And so when I couldn't sleep, I started to use alcohol. So I was drinking high doses of high proof alcohol on top of all these drugs, trying to sleep. It was a very complicated scenario. And so what finally happened, I had a near-death experience in my home. There were many parts to it. I never saw the tunnel or any of that. But in this near-death experience, what's relevant here is that I was told what to do. I lived in close to Portland, Oregon, and so I was told to fly to my sister's house in Iowa. I was told not to tell my sister I was coming. I was told not to tell my husband I was leaving. I was told to take all my drugs with me. I don't remember taking any clothes. I mean, I was just so whacked out of it. I mean, I was so whacked out for those years. I didn't even have a Gmail account. I didn't know what YouTube was. I mean, I was really disorientated. And so and another point in this near-death experience, I was told that I would be helped. And at one point, I worked at Hazelden, and that's drug and alcohol rehab. And so, yeah, I know. And so I knew that coming off benzos was very lethal, that it's the most lethal to come off of. So, but I was so whacked out with all these drugs that it wasn't the forefront in my mind. I was just going by what I was told. Telepathy, they use telepathy. And so there were many other parts to the near-death experience, and even that near-death experience impacts me greatly even today, and I'm very grateful for that. So I flew to my sister's house in Iowa, and I remember breaking pills, and I was so whacked out, I didn't write anything down, and I was on so many drugs that, a large counter, because you have the side effect medications and all that. I had so many drugs that I was on, and I wasn't even thinking, I don't think at the time, about the alcohol that I had been drinking, but I had benzos, so that was covering that.
Yeah.
But I just remember breaking pills, and I know that I had to go to the ER a couple of times because I was pretty sick with my asthma, and they threw me on steroids on top of all these drugs I was trying to come off of, and steroids further destabilize you. And so my sister was very helpful because she was very militant with me, and she'd have me up first thing in the morning, even if I hadn't been sleeping, and get in the shower and put some makeup on and get dressed and walk to the end of the driveway. And these psychotropics, as many know, cause significant weight gain. And I had gone from 124 up to 325 pounds. And so I was very obese and very unhealthy. And so she'd make me walk to the end of the driveway, which was not very far, but I had a heck of a time, back and forth to the driveway. And so she did this for me. And within 6 weeks, I was fully off all of these drugs. And in retrospect, I look back, and I was talking with somebody a couple of years later, and it gives me goosebumps. I've got goosebumps now thinking about this, because God has been so great to me in my life. And so I was talking to her about this near-death experience, and I said to her in that moment, I said, "Oh my God, during that same time, I was detoxed off all those levels of that level of alcohol too, because I didn't come back. I didn't drink the whole time that I was there, that I recall, and I came back not drinking. And so I was cleaned up from all those drugs in 6 weeks, and then I came back and pulled my records, found an attorney finally, and set up ECT Justice. So my life is a miracle, and I attribute it to Source. Yeah, Source.
Oh, 100%. And it's sometimes it's so interesting. It's almost like you have to hit rock bottom to find that connection. I mean, you're blessed that obviously other people would debate that this sounds horrible that you died, but the NDE is probably what really you're here today
Saved me.
because of that.
Right,
And
right.
source did provide, didn't they, in your case?
Yes, yes,
They really
greatly.
did. And so that's a really touching story. Now, what I want to say on the NDE is um, I think that a lot of people in the benzo and psych drug community could find refuge in the NDE community. Like even if you don't die and have that direct experience or these grand mystical experience, I think connecting to the NDE community will give an understanding and purpose of this journey and can help us get to the end. I mean, that's certainly my journey. I also had multiple mystical experiences that led me to the NDE community and is a big part of why I'm still here today. So I am so happy that you got to share your experience today and to
Yeah.
let people hear your story on that. So thank you so much for that. And so before we get into like, I guess, a few other questions of the lawsuit, did you after those 6 weeks, that is a rapid taper, as you know
Yeah,
now.
it was.
That is, I mean, very dangerous. And my question is, did you have lingering symptoms after those 6 weeks?
I'm sorry, I got my phone going off. I can't
Oh,
shut
no
it down.
problem.
I guess I did shut down. That's okay. Okay, so the 6 weeks. So the one thing that I noticed that when I came back was that I did have, I think for a period of about 6 months, that I stayed. One thing I did stay on, and this psychiatrist, not the one I sued, but the one that I later reported to the board, she kept me on Depakote for 6 months. I want to say that because of the seizure risk, and I agreed to that. I wanted to be off everything, but I think I stayed on the Depakote even while I was out there because I cognitively knew from working at Hazelden I may still be at risk, and so she kept me on that Depakote for 6 months. But then I came off of it. But I know for at least a year or two, maybe even longer, I would have like the electrical symptoms going through my body, the buzzing. I have major neurocognitive disorder now, diagnosed by a neuropsychologist. That can be secondary to benzos and also the ECT. She tried to attribute it mostly to psych, like they do, but she revised it like 3 times. I said, not happy, not happy. Just sent it
Yep.
back. And address what the real issue is here. And so she finally capitulated and wrote down and actually had me in her notes attend brain injury rehab programs, attend brain injury rehabilitation and support groups. So she really stepped up. So the symptoms that I had were gone, I think, after a couple of years. My sleep was greatly impaired. I remember that still. And so I turned to alternatives like the magnesium glycinate, GABA, ashwagandha, passion flower. I mean, because of the brain injury, many brain injuries secondary to ECT that I've had, the sleep is again impaired because of that. Yeah, so I think taking those supplements has really helped me a great deal. And I try to exercise at least daily or at least 5 days a week, ground myself, bare feet on the ground, keep my mood elevated, practice gratitude. And as you said, these near-death experience groups would be highly helpful because people have hit rock bottom often when they have these experiences, and it gives you hope, I feel. And people that have had these experiences carry a great deal of wisdom and insight too around suffering. That suffering can actually be quite beneficial, and these labels that are given to us, I feel, are often not attributed properly to spiritual gifts or dark nights of the soul that people have to go through.
That's
And
right.
that sometimes these drugs separate us from these experiences and the experiencing these deep emotions that bring us to source, and to separate us through these drugs and electroshock when we need this pain at times to bring us to our knees, as I say.
100%. And thank you for so much for sharing the things that like how helped you through your journey. And I cannot agree with you more. I think some of our great mystics are stuck behind walls in psych wards because our
Mhm.
system has labeled it, and the voices and all of these are like some of our most talented people that are
Shamans
hiding
and healers.
behind these walls. So I
Mhm.
appreciate you bringing that topic up and the things that helped you. Can I ask, and I know the people listening are going to want to know, I mean, there's clearly there's been time since then to now. Where are you today?
Where am I today? I stay far away from psychiatry.
I'm
Um,
sure.
I haven't been on psychotropic drugs since I think it was late 2011.
No.
Um, um, uh, I still work. I thought at one point that I was going to get away from activism around electroshock, that I turned over the website to the attorneys that were doing the product liability suit. But I think when you're so passionate about something that you know so very well, given your training and your work experience, that this is harm, that this is trauma, that these are brain injuries they're inflicting. You can't sit silently by and do absolutely nothing. So and I think that my all the labels that I carried in the psychiatric system, I think personally that I was very late diagnosed, neurodivergent, autistic, ADHD, and caused a lot of communication problems with my psychiatrist. I didn't disrespect them, but I didn't esteem them either, and would try my very best, given my impairment, to address my care. But then again, I would be disinhibited by all those benzos, and my mouth would just get a yapping
Yeah.
sometimes and get me in a world of trouble. And trying to advocate for myself, and a lot of these psychiatrists have big egos and don't like to listen to patients that know very well what's going on with them, and prefer not to have all these labels assigned to them when they're having social situations going on in their life, or marital situations that don't warrant, that will clear up, once these extraneous things are resolved. And you don't carry a lifetime label. I don't believe in lifetime labels, and I don't agree with. I think that when we go into these groups like NAMI, that always pushes agendas like stay on your meds, and they're loosening up with using some alternatives now. But I tell you, I was ushered out, well, not ushered, emotionally ushered out, trying to discuss ECT and alternatives, years back. Because you present real documented evidence, and they're so entrenched in gaslit and have drunk the Kool-Aid, that they go with this agenda, and it's very harmful to patients. And I know around ECT that I've offered to help patients that want to bring litigation around medical malpractice claims. I sent snail letters to all these NAMI organizations across the United States, asking them to share the information so they can let their NAMI members know I'm willing to help them bring lawsuits around their brain injuries from ECT. And I repeatedly got notice I left my emails through emails that they would not be doing that, that they were going to keep that information to themselves, because it goes against NAMI philosophy.
And I'm glad that you're speaking about ECT because I think this is an important topic because it's something that I see come up in the community often. Someone has been injured by psychiatric drugs, and then there's this suggestion by a doctor or the community or
Mhm.
someone that says, why don't you look at ECT? And I want to make this clear. The only way out of psychiatric drug harm is staying away from psychiatric drugs
Mhm.
and doing anything else to the brain. Psychiatric drug harm is a functional brain injury. It is
Mhm.
an injury from inside out versus structural. I know, I mean, I suffered a structural brain injury and now I know what a functional brain injury, and this is a billion times worse than
Mhm.
the structural brain injury. You can't even compare. And so, there's this notion that, oh, ECT is going to restart the brain. First off, they don't even understand, these doctors in these institutions don't even understand what ECT does really to the brain. And I haven't seen, I mean, the amount of people that reach out, I don't see people it's helping. I've only seen people that are being injured and left with more injury after. And so I'm glad you're speaking about this because it's a common question that comes up, like, should I do ECT or should I do ketamine? And the way out is slowly coming off the drug and organic and finding alternative ways of healing, spirituality, CBT, EDRM. At some point when your brain is more healed, because we should not be doing EMDR or brain spotting when we have a brain injury, a functional brain injury or structural. But diet, there's so many natural ways of healing and understanding our trauma that led us on this path versus electrocuting it's just mind-boggling to see that this is where our system has gone. So thank you so much for sharing that. So why don't you speak a little bit more now about the lawsuit and like how did you find a lawyer to sue and like what did that process look like? How long did it take? All of that.
Yeah. All right. So let me address one point first and then get me back on topic. Okay.
Please.
You know how I can get. So so they always claim they don't know how ECT works, but I know full well, working level 1 trauma for many, many years, that if this happened one time to a patient, like say at home, you know, even to their arm, say they had a low voltage electrode incident to their arm and it caused unresponsiveness and seizure, you would immediately think a traumatic brain injury, even if it was to the arm. If the unresponsiveness and seizure occurred, you would think traumatic brain injury. Never mind if it happened to the temples, that would be an automatic assumption. So when you have a traumatic brain injury, you have temporary euphoria. You have failure to remember what brought you into the hospital. You have gross confusion. You're highly suggestible given your neurocompromise. Everybody's telling you, oh, you look great. Your family says, oh, she's not complaining anymore. You have anosognosia. Anosognosia means you don't recognize your incurred damages. You can't tell that you're punch drunk, that you just come out of fighting ring and you're stumbling around. Everybody says, oh, you look great. And you're just taking your meds and going along with the program. Because you're highly impaired. When you have ECT, they go for the flat line. They go for the flat line. So you're having a significant brain injury. And that electrical trauma doesn't just impact the brain. It impacts every cell, every system in the human body. And people and electrical trauma evolves over time and damages. So my peers a decade out are having brainstem microbleeds. They're having symptoms of ALS. They're having symptoms of CTE. When we had the product liability suit, one of the experts on behalf of ECT survivors was Dr. Bennett Omalu. And Dr. Omalu was the CTE expert around the NFL head injuries. He was the expert on behalf of ECT patients. You have psychiatrists on, where was it, on Quora, that were actually telling a pregnant woman, this one psychiatrist telling a pregnant woman that she had ECT, and he was encouraging, because he sends pregnant women for ECT, that it wouldn't impact her baby. When in fact, there's an incident of infant mortality and stillbirth and fetal demise, same thing, with ECT use. And he said it only impacts your brain, not your whole body, which is not true. It doesn't just cut off at the head. It impacts every cell, every system. And when I was contacting attorneys to bring this product liability suit, when I had attorneys that I would talk to that were double boarded in medicine tell me right out, and they weren't even psychiatrists, oh, everybody knows these are brain injuries, there's a real problem here. And you can't get psychiatrists to step up because there's so much money involved in this. People don't know how much money, and they've gone off label for this. And when they say, oh, your psych meds aren't working, you're treatment resistant, and they throw this at you, good luck getting help for your brain injuries, because a lot of these brain injury programs are tied to hospitals that use ECT, and you will be gaslit. You'll be put on more medications to address your symptoms, and your family members will be lied to, saying this is a psychiatric issue and you need more ECT. And I've lost peers to suicide because they're gaslit and written off because they've had 30, 40 acquired traumatic brain injuries to varying degrees. And so I just want to point that out. They know full well because they do rotations in neurology. And so they know these are TBI, but nobody has the ethics to step up and say, this is grossly wrong. And patients that have had this, it's so frustrating because the harm that they're going along with, and you try to educate them. But they're so aligned with their psychiatrist, nobody wants to think their psychiatrist would harm them. And the great sense of betrayal you feel when you come to the realization, whether it be drugs that they didn't tell you were highly addictive and hard to come off of, and that they're not going to stick around and support you while you come off these drugs or while they taper you off these drugs, that they're going to cause you a problem in your records, calling you non-compliant, and give you all these, or borderline, and make derogatory labels about you so you have more care impact problems. And these psychiatrist notes follow you in all your care. The primary looks at it, oh, borderline, or don't take her seriously. Real issues here. My darn phone, they never call me, but now I get calls. And and so yeah, so I just want to make that point. And so I had settled 2 other lawsuits, so I had that behind me. As far as credibility, I had a long-standing career with good letters of reference, so I had that behind me. And so I thought, this should go along like the other lawsuits did, that I should not have a problem getting an attorney, because it was blatant malpractice. I mean, anybody can tell you 25 milligrams of Ativan on that alone is malpractice. And so I could not get an attorney. I was sending them all these records, I had stacks of records. I highlighted all these things. Very healing for me to go through all these records, trust me. And so I made their case for them. I had books highlighted. I went in with stacks of books highlighted, did his job for them. And so I even looked at, so if you can't find psychiatric medical malpractice, I started researching other successful lawsuits around benzos. I started researching psychiatric lawsuits. I started researching pharmacy lawsuits, because they fill these prescriptions. And so they can also be held accountable. And so what you have to overcome as a psychiatric client with a passive psychiatric history is the stigma that you're not reliable, that you're not going to stick it out. I even had to go through a mock trial to make this attorney satisfied, that I paid for to take this case, or he'd have taken it, but, to pursue it further. And so and be aware that psychiatric medical malpractice does not pay out compared to medical malpractice. I don't care what your damages are and how it impacts you the rest of your life. It's a terrible payout. And try to get it to go to court. I was bamboozled in the settlement hearing, or the settlement proceedings, because I thought it was going to go to trial, and everything was decided in a settlement, and I was not happy. And I had a bully for an attorney that turned bully, because he wanted his 40% and didn't want to put additional work in. So get that very clear. If you get an attorney, I am not going to settle with an insurance agent, and that was hell. That was 8 hours of hell, being grilled by this attorney in its deposition, and it's highly stressful, and you better be prepared, because they put you through the ringer. They ask you all kinds of personal questions, trying to discredit you and shame you and stuff. So you've got to be very strong when you go in there, and very ticked off, that you stay the course, and realize that it's not going to pay out well if you settle. And so so I was thinking the other night, thinking about this talk, what finally got me the attorney, because something happened that I had totally forgotten about. And so, because I was not getting an attorney, and I was even going out of the state of Oregon looking for a national attorney, which you can do. And so some were interested, but as soon as they heard psychiatric, it was over. So what I finally thought to do, and this is inspired, I think, by source, I think just came to me in an instant, was when I worked at Hazelden, the pharmacist that was in town would come up and fill the carts, and he and I were on good terms. And so I decided I'll take 20 pages of my pharmacy records to this pharmacy he had a pharmacy business too, and ask him to review my notes and write me a professional letter, his feelings about my damages around these prescriptions. He, and not only he, but his fellow pharmacists wrote me letters. And that's how I got my our attorney. Had they not stepped up and said, this is BS, she should have never been on, these are lethal drugs, never should have been on these drugs. I don't think I could have found an attorney. I really don't. I think that when you look for an attorney, you get all your records, you highlight, you go in with your argument, you bring any kind of professional standing behind you, any kind of professional credibility in letters, your internist doctor's letters. That it's sad that you have to do this, but you have to. And find a pharmacist friend if it involves drugs, and look at other lawsuits that have settled, that have been won. Because that'll give you some guidance, and try to align with one that matches close to what your situation is. Yeah. And look at your time frames, because they're not going to take your time frame. And you have to ask them this too. When you discover your damages, that the time frame may start, or when the incident actually occurred, like from the first prescription. And if it's benzos, they had a duty to you to warn you that these were addictive after 2 or 3 weeks. They had a duty to not abandon you when you want to come off these drugs, and to titrate you off these drugs. A physician that abandons you can be sued. And if they're said, well, I'm not going to deal with it, I've been prescribing all these years, good luck, you taper yourself. That's a danger. He's putting you at risk. Mm-hmm.
What fantastic information you are sharing, Deborah, with all of us. So I cannot thank you enough for what beautiful information. And you're right, because there's the statutory limitation, right? And every state is different. So like, I think in like Florida is like 2 years, New York is 2.5. And so but you make a valid point of like, what is considered? Is it the discovery of the damages, or from the first time you saw? And when I was investigating lawyers, I was told it was from the time of prescription, the first time of prescription. And I'm like, that, how can you even conclude to that? Like, that's the beginning of the harm. That's not, how would you even know that's going on? And so, but I think you make a lot of valid points there. And I think another thing is, like, in your case, you were able to get the pharmacist to write these letters, which is great. That may not be possible for everyone, but you can find an expert in benzodiazepine harm and psych drug harm and pay them and say, hey, these are my records. This is what I've gone through. Can you write a letter explaining how I should have never been on these drugs, how there was no informed consent, that I was never informed about, physical dependence, like all of these, like whatever information that expert can write, that is what's going to get the doors open with lawyers. So Deborah, that was such fantastic information you were sharing with us.
And another point I want to make, because I'll forget if I don't say it. I hate to I'm sorry to interrupt you.
No, please.
Is that when you have these, all right, so when you look up like benzo damages, like the bind, what you want to do then is you want to get appropriate testing to show your damages. So like get a neurocognitive testing done. Any symptoms that you're having that you can align with benzodiazepines, get those symptoms addressed and tied to the benzodiazepines in your medical records. Now, be aware that you're going to try and align everything to psych. You say, yes, I do have a psych history. Like when I got my neurocognitive, true, I do have a history of PTSD and depression, but again, that can be tied to electrical trauma, which electrical trauma causes. But mainly I have brain injury that's documentable. But if they want to do it with psych also, make them do it with both those things, benzos and psych, or benzos and neurocognitive compromise.
This is a really good point that you're bringing up, and something to add to that in terms of like physical testing. I mean, psych drugs tend to cause a lot of vestibular issues. You could do a vestibular testing. There's testing. You could go to the, ENT and get that tested. There's also neuroreceptor testing now, right? You do a urine test or blood that can test your neuroreceptors, and it will show that your neuroreceptors are upregulated or downregulated. And so that is all evidence, to your point, physical evidence that will carry a weight for sure. So that's a good point. So, and I have like another question for you, because the interesting part is that you are a nurse and you were educated by the system. And so as a nurse, how has it impacted your trust of the system, knowing what these psychiatric drugs have done to you and ECT and all of these experiences? Like, do you struggle with trusting the system now? Like, what is your relationship there?
Yeah, I do have a lot of trauma around care providers, especially, and it's not just because I've had ECT and all these drugs. I mean, I think people that carry a psychiatric history always have that sense of, oh, they're going to see it, and because it's true, they do. They see psych right at the top. And I worked ER. I can tell you, when we have, I don't care what you showed up with. If you came in with a motor vehicle accident, there's that symbol of psych. If they find out you have psych, it's beside the motor vehicle accident. If you come in with pneumonia, psych most likely will be beside it. And so there's a great stigma there. I was going to be, ironically enough, I wanted to be a psych nurse at one point, right out of nursing school. I can't believe it now, but I did. But I saw a lot of psych patients in the ER setting, and I was always happy to take them, and they were always glad to give them to me. And so you have to be cognizant that people view you that way. And so I really struggle because I come in very defensive. I come in hyper vigilant. I come in ready to fight tooth and nail for what my needs are. And I know sometimes I bleed on other people that don't deserve that. And I work really hard to give people the benefit of the doubt. But even the other day, I stay very far away from allopathic medicine if I can. Around ECT, this electrical trauma brings a lot of issues, cardiac and dysautonomia that I suffer with. And sometimes I don't have a choice but to seek out allopathic care. And in fact, I had to see a new doctor yesterday, in fact, and luckily he was very nice and we clicked. But the one prior to that, I won't go back to him because of the way he made me feel. And so you have to make sure you have a really good fit with your care provider, that he was gracious enough, though I didn't have my records at the time. I actually had to end up going back to Kaiser Permanente for my care, giving my costs. And that is hard for me to go back to Kaiser Permanente, even to have my card in my wallet. And when I get in the system, it's like all over again. So this guy had me on the defensive, but he was very kind, and I'll give him the benefit of the doubt. He let me do my own suggestions and was amiable to those. He took bipolar off my diagnosis list. He took other diagnoses off my list when I showed him what my actual diagnosis is now. The autism, ADHD, and the CPTS or the PTSD. And so that I was grateful for. But I go to a naturopath. I don't trust. I talk to a coach now, deal with my codependency issues. She's much better than any psychiatrist I could ever see.
Yeah.
And I'm not saying that all psychologists and psychiatrists are bad, because I've had a good psychiatrist, I've had a good psychologist, but I don't like the stigmatizing, and I don't like the pathologizing that goes on in the system, and giving people lifetime labels and very powerful drugs that they're blamed, that patients are blamed for when they're not responding appropriately, and given additional labels given that.
Thank you for sharing that. And I cannot agree with you more. I mean, I think the system is so busy putting you into a box to match a diagnosis so you can be drugged, when the reality is a lot of these symptoms, like there's no gene for depression. There's no gene for anxiety. The whole thing about being genetical, it's yes, generational, right? Generational, but genetical is another topic. And I think the system is so busy trying to put us in a box versus understanding that depression, anxiety, personality disorder, bipolar, schizo, this is all a byproduct of trauma. And we need to start addressing the trauma and the root and understand that it all goes back to safety. And like, if we understood that, we like being labeled, and that becomes your identity. That becomes, oh, I'm broken, right? And that's what the system wants. The system wants, I'm going to label you so you feel broken, and then you need me. And that's what's happening on a subconscious level, right? The system doesn't like, doctors don't think that's what they're doing. They think they're actually helping, but they're so part of this matrix and the system, they don't even realize that they're actually harming us significantly. And you are a walking example of that. How much harm happened to you?
Mhm. And another important thing, and I want to be very vulnerable here because I don't take pride in this, okay? Is that when I was in this terrible marriage and I didn't have really any allies, I didn't have any family in Oregon and stuff. And I really looked to psychiatry to be my support system. You
Hmm.
know, I had such a good relationship with a psychiatrist in Denver that I transferred those feelings to this new psychiatrist, which was not appropriate at all. And so they were not the same person. I get that now, and didn't have the same agendas. Her agenda was much more to put me in a box, and she was the one in power. She was the one in control, and she was going to teach me a lesson. Was my outcome in that experience, and I would often go out of pure loneliness and the need to be understood and the need to be seen, and even sometimes, and this is terrible to say that even with my bipolar diagnosis, I would sometimes even in the early years before I got to impaired on all the drugs, I was, oh, it's my bipolar or whatever. You know, it kind of eased me out of the responsibility, whether I bought something or you know, some other irresponsible, immature behavior that I could
That's right.
tie to that diagnosis. And it's very shameful for me to have to admit that now. But I think, you know, even 5, 10 years ago, so it used to be such a stigma to be, well, it is on some level to have a psychiatric diagnosis. But now, you know, it's like a sense of belonging. You have all these groups. Well, I'm this and I have this,
That's
and
right.
people don't realize how insidious it is and how we give our power away by taking on these labels, by taking on these drugs, and you get caught in this system, and it's very dangerous. I know personally how dangerous it is, and I gave my power away. Um, you know, initially I gave my power away. Later on, when I was so compromised, I couldn't take it back. I couldn't tell
That's
which
right.
way was up. And it took me, you know, being so broken toward the end that I was like shards of glass that I had to sweep myself together to want change so badly for myself. And so don't let these labels they give you be your defining moment, because you're so much more than that. Yeah, so much more.
What a beautiful message to share. And you
Mhm.
nailed it on the head. You nailed everything on the head. And I think these are important messages for everyone to hear, Deborah. I
Mhm.
know we're at time, but I would like to ask if someone wanted to find you on social media, would you mind sharing with everyone where they can find you?
Yeah, I have. Well, right now I do. I get off once in a while. At ECT Justice, one word on TikTok. I'm also at Grand Trined, and yeah, those two are good to go to. Yeah.
And I'm going to put it all in the description as well, Deborah, so people will be able to
Okay.
find it in the description as well. But
And thank you so much, Melissa. I appreciate your time and your energy around this topic.
no, absolutely. And I cannot thank you enough for showing up today, sharing your story, and being vulnerable with us and
Mhm.
sharing your truth and your experience. Like, I believe everything you shared today, and I can only imagine, right? You're years out and you're more grounded in that. What that
Mhm.
path and that journey is. I mean, you died through this journey and you had to
Mhm.
rebuild, and you're someone that's standing in front of us that is, gone through the work and is here today
Mhm.
to share your story. And that gives our community hope.
Mhm.
Watching and listening to your story, we all hope to be there and healed and on the other
Mhm.
side and have gone through this. But thank you so much for sharing all of your details. Seriously, Deborah, thank you so much.
My pleasure. And people can DM me, and I'll try to assist them if they want, you know, help with lawsuit. You know, I can assist them with writing submission or answering any questions that I can for them. Mhm.
Oh, that's fantastic, Deborah. Thank you so
Yeah,
much. And again, I'll put your information in the description so people can reach out when needed, okay?
my pleasure. Thank you so much.